Hi, this is Dr. Bob Dannenhoffer. This is another of our COVID conversations for January 13th, 2022. I'm the public health officer for Douglas County. We've been doing these for many months now and have been doing communications through Facebook for many months. So this is a sort of a special COVID conversation because COVID is different than it's ever been before. In the world, we're having 3 times as many cases now as we ever did previously, even during the very worst times in last summer or during the Delta surge, 3 times the number of cases. The disease is very prevalent in Europe, in the US, Canada, Argentina, and Australia. The good news is this peak seems to be shorter. So South Africa started in late November and they peaked in the end of December. We think it's already peaking in London. Started in London in early December and is probably peaking this week in London, starting to come down. And Denmark, which also started in early December, has probably peaked in this last week and is starting to come down. Unfortunately, in the places where it's coming down, it's not going down as fast as it went up. So we don't know how quickly it's going to come down. In the US, it's really hot in the US. So we're at 235 cases per 100,000 per day, 235. We were down to 20 just a few weeks ago. So this is about 10 times as much disease as we saw just a few weeks ago. It is really hot everywhere in the US. There's almost no place which is untouched. And amazingly, actually, Douglas County is one of the lower places right now. I think it's already peaked in New York and New Jersey and Puerto Rico. Those started out again at the very early part of December, and they're peaking now in this first and second week in January. So as we've thought before, between 3 and 4 weeks from the early stage until the peak. Unfortunately, they've gone up very quickly, but rather than coming down quickly like they did in South Africa, these are more broad peaks, and it looks like it's going down slower than it went back up. The number of hospitalizations in the US is at a record high. And this is a bad time of the year to have record hospitalizations for a couple of reasons. One is there's just a lot of other disease this time of the year. The second is that we're seeing during this surge a lot of hospital workers, even though they were vaccinated boosters, get mild cases of the disease, and thus they're stuck at home. That's a worry because every time there are people who are infected, they can't work, and there's just fewer people to carry the load. The third reason is that the hospitals, just like the rest of us, have had trouble hiring people, and so they have a lot of open positions. Now, many of these open positions are medical positions, nurses and otherwise, but some are other positions, couriers and other things, and a hospital really needs everyone to keep going. So we have lots of admissions at a bad time of the year, at a time their staffing is low, and so we're really worried about what's going to happen to our hospital. In our hospital system. For example, there's an outbreak today at an Oregon hospital, and it's basically going to make it almost impossible for them to continue to provide emergency services. In Oregon, we're having a record number of cases. We had 10,000 cases on Friday. I think that was a little bit of an aberrant thing, but yesterday we had 8,700, not at all aberrant. And so it looks like we're going to have more and more cases every day. In Oregon, we're averaging 295 cases per 100,000, really a really high number. And when you look at when you look at the counties, Deschutes County at 295 cases per 100,000 is leading the pack. So think of this: Deschutes County, not even twice our size, having over 900 cases a day. So that would be like us having 500 cases a day, just an overwhelming number of cases. Douglas County is a bit behind in this, which is a good thing, giving us a few more days to plan, but I think it's really heating up. We had 200 cases yesterday, and we had 100 cases when we started work this morning, so we're like to have even more. Hospitalizations in Oregon are going up. Hospitalizations in Douglas County are going up, but slowly. But again, we remember the peak of cases usually is followed by hospitalizations 8 to 14 days later. And so we're worried with this steep increase in cases over the last week that in the next week we may see an increasing steepness in the number of cases in the hospital. And that's going to be a real worry, again, because the hospitals were already strapped at the time. So we got a number of really good questions this week. If you do have questions, please send them to us at Facebook questions at douglaspublichealthnetwork.org. Again, that's Facebook questions at douglaspublichealthnetwork.org. One of the questions is, what should we do for masks? So during this whole time, we've talked and we said, well, public health is like the weatherman. We can't really control what's coming at us. We can go ahead and minimize the damage by stopping spread, decreasing hospitalizations, but we really can't change the variants or the variants that are coming at us. So we're really like the weatherman. And so if the weatherman was saying there is going to be the worst snowstorm Douglas County has ever had, it's going to be bitterly cold, you would then figure, I have to wear my heaviest, best coat during this time. So similarly, it's going to be bad COVID weather. There can be a lot of cases, a lot of that, and you should wear the very best mask you can get. Well, what the very best mask is, that N95 hood thing that I wore back in the early days to preserve PPE, that gives 99.5% protection. That's absolutely great. There's only 10 of those in the county. So the next best would be to use an N95 or a KN95 mask. Those are really good. They're fairly widely available. And we would recommend that you wear the best mask that you can tolerate. As masks get better and better, they get more and more uncomfortable to use. So the best mask you can use would be best. If you have an N95 or a KN95, I would wear it. If you only have a surgical mask, you might consider double masking with a surgical mask and a cloth mask. That gets it up there pretty good. The most important thing is to wear a mask in the first place. Go out to the stores and other places and see a lot of people not masking. I think during this time of really high disease, it really is important. It'd be sort of like we had a bad snowstorm and people were there in shorts and a t-shirt. You think, what are they doing? So this is a time, it's the analogous of a really bad snowstorm. So wear the best mask you have. The good news is that this isn't going to last forever. This surge is going to be over, and this surge may be over as soon as the beginning of March. The second thing was about tell me about vaccines. So what we're seeing with this is that this new variant is new and different. And since it's new and different, prior infection does not provide great protection. So in the past, if you had one of the ancestral strains back in 2020, you had about 85% protection from getting alpha. If you had alpha or one of the ancestral strains, you had about 85% protection against delta. So previous infection was pretty good, not perfect, but pretty good in preventing you from getting a new infection. That's about what we saw. Unfortunately, with Omicron, prior infection only gives you about 20% protection. And so we've already seen a bunch of cases of people who had Delta, got pretty sick back in August and September, and now pretty sick again. So previous infection does not provide good protection against Omicron. What we think does provide good protection is if you had a previous infection and then get one shot at least of the mRNA vaccine. So most of our cases in the past who had the disease did not have any vaccine, but if you get now one shot, you're thought to have pretty good protection against Omicron. So I'm pleading with people who had previous cases in August and September who thought they were good. You're not. You really need to go ahead and get a booster. The other thing that we found is that the original series of the vaccine gives you about maybe 30-35% protection, but with a boost that goes to 75 to 90%. So we're really encouraging that anybody who's eligible for booster, and that would be anybody who's 5 months from their second shot of an mRNA vaccine or 2 months from their J&J vaccine, please, please, please get a booster, because we know that that will help to prevent you from getting the disease. But most importantly, it's going to prevent you from getting sick enough to be hospitalized. Now, it'd be great if nobody got this disease. But if you have a mild cold and sit on the couch for a few days and watch Netflix, that doesn't bother me very much. What does bother me is that people get sick enough and they're going to need to be in the hospital and the hospital gets overwhelmed. That is really what worries me. And we know that some people will die already in the places that had early surges in New York, Chicago, and Boston. They're starting to see an increase in deaths from Omicron. So while overall Omicron may be less serious, with the number of cases we're going to have, it could still be overwhelming, and we might still have a lot of cases. So please get the vaccine. We have a booster clinic here every day in Roseburg from 10 to 5. They're doing all 3 of the vaccines, and they're doing testing. It's easy. It's a drive-through. I've driven by a dozen times, and there's never been much of a line. So please, please, please get a booster. And especially if you had the disease in August and September think you're bulletproof. You're not. You really need to get a booster. So please get a booster. And if you're due for a booster, please get a booster. If you want to get tested, they can go ahead and do testing. Which brings us to the next thing. What are we now recommending for testing? So early on in this disease, we recommended testing. And one of the biggest reasons for recommending testing is so we could see little outbreaks. And so there was a time, there were many times during this pandemic when we would have 4 or 5 outbreaks in town. Our case investigators would work very carefully with those outbreaks so they would be contained. And we think when we've looked at it that most of those outbreaks were then contained after 2 or 3 incubation periods. So 5, 10, 12 days afterwards, there were no more cases in that area and the disease died out. And so we protected a lot of people from getting the disease. And so when the disease is low, you do the testing to find outbreaks so you can go ahead and stop it. Right now, there is so much disease out there. There are hundreds of outbreaks, far too many to do, and many which are overlapping. So a family where people work in different businesses, they're in now different businesses, and there's just no way in the world to go ahead and manage all of that stuff. So right now, what we're saying is that getting tested to figure out where outbreaks are really not important unless those outbreaks are in high-risk areas. The jail, nursing homes, shelters, things like that. Those are really important places that we want to know about. But an outbreak in your house, an outbreak at work and whatever, there's no sense actually in following those up at this point. So what we're saying is if you're sick with symptoms of COVID, you probably have it. Stay home. You don't really need to go out for a test, and we don't even want you to go out for a test because when you go out for a test, you may expose others. Please don't go to the emergency room for tests. Stay home for 5 days. And then after 5 days, if your temperature is down and you're feeling better, you can go back. If you're still not feeling well, wait until your temperature is down and your symptoms are better, and then you can go out. You've almost certainly had COVID, and you're then good to go after that 5 to 10 days. Now, 10 days is best because we know at 10 days there's no chance that you'll spread it. But at 5 to 10 days, there's still a little chance. So if you are going to leave your house after 5 days, wear a mask. We're also asking that if you think you have it, to contact your contacts. And your contacts would be people you had close contact with in the 2 days before you had symptoms. In the past, our epidemiologist did this, but with 500 cases a day, we're going to have 1,500 contacts. No way to contact 1,500 people a day. So we're asking you to contact your contacts and say, look, hey, I came down with it. And then they should go ahead and quarantine. And the quarantine would be if you're fully vaccinated and boosted, don't need to do anything. If you're not fully vaccinated and boosted, then you should lay low for 5 days. If at the end of 5 days you're feeling better, you can go back. You should still wear a mask. But if at the end of 5 days you want to get tested, that would be a great use for a home test. So if you had a home test to do it, if you don't need it. After 5 days, if you're asymptomatic, you can go back and do it. Again, this is not going to stop the disease in its tracks. But what we're worried about is that if everybody got it at once, even if only 1% of the people needed to go to the hospital, it would overwhelm the hospital. And so what we're asking for people is to slow the spread of this over the next few weeks so that we can preserve our hospital capacity. And hospital capacity is very important because there's a prediction made by Dr. Peter Gravens up at OHSU that at the end of January, the beginning of February, we're going to have about 1,600 people in the hospital in Oregon. That's going to be a lot of people. You remember back in August, September, we had about 1,200 people in the hospital. And here it was pretty dire situations. I mean, we had to call the National Guard in, we had a trailer out front, all of those things that really made it hard for us. And in a few minutes, we're going to talk to Dr. Gray, who's the Chief Medical Officer of the hospital. He can tell us more. The last question we got is, well, tell us about these therapeutics. So there are some things you can do for COVID. So for people who are hospitalized, you can use the remdesivir and the Decadron, but that's really only for people hospitalized and quite sick. There are 2 new oral antiviral drugs. There's one called Paxlovid and one called Molnupiravir. And I'm glad to say that they're beginning to arrive. The first doses of Paxlovid have arrived in Douglas County, but there's only 20 courses. So with the number of cases we have, we really have to prioritize this for the people who are really at the highest risk. And those are people who are either very old or people over 80 or people who are 70 and above who have a condition where they're not going to make good antibodies, like they've had a solid organ transplant or some other big trouble with their immune system. The other ones are the monoclonal antibodies. The monoclonal antibodies worked great for Delta. So the Regeneron and the Eli Lilly product really worked very nicely against Delta. However, they do not work against Omicron. And the recent data from Oregon suggests that 100% of the cases in Oregon are now Omicron. And so, unfortunately, those two monoclonal antibodies are not available. There is one monoclonal antibody that does work for COVID, and that's called sotrovimab. We've got a few doses here in town, and again, that is being prioritized for those people who are the very sickest. So we're pleased today to welcome Dr. Jason Gray. Dr. Jason Gray is the Chief Medical Officer over at Mercy, and it looks like you just came out of the OR.
Hey, good afternoon, Bob. How are you?
Good. So for people who don't know, Dr. Gray is a very skilled anesthesiologist, in addition to being the Chief Medical Officer at the hospital. So I was the Chief Medical Officer there for a while, and Dr. Gray more than filled my shoes. So tell us how things are going over at the hospital in the COVID world.
I'd love to, Dr. Dannenhoffer. Thanks for the opportunity on it. Well, right now, COVID in the hospital is controlled. We have 12 to 14 inpatient COVID patients, and I count that as a victory right now. Some of the issues and planning that Dr. Dannenhoffer, you've already spoken of, are still working on it. We are making a lot of preparations in anticipation of this potential surge. Obviously, we're hoping for the best, but planning for the worst on that. Working with our community partners, first and foremost, to make sure that patients receive care in the area, the location they need. Saving those hospital beds for those patients, those few who will become truly ill and really need the beds. A number of issues we're working on: staffing. Obviously, staffing is a challenge in any industry right now. Been working with the Oregon Health, been working with our local community and county emergency plan on it to find travel through state and different agencies. We're also working with the National Guard, who will be deployed across the state. We'll be receiving somewhere in excess of 20 National Guards people on that next week, really trying to ensure that we have the capabilities, staffing, et cetera, to take care of those who really do need to be in the hospital.
So one of the things we mentioned before you got here was, please don't just show up at the hospital if you're not sick and just want to test. Tell us what you think about that.
I think it's actually a great idea on it. Number of reasons you don't want to be in the hospital. First of all, saving it for those who really do need hospital level of care. Secondly is you expose others, and you can potentially expose yourself to others in that. So we really want to save that. As Dr. Dannenhoffer mentioned, the majority of people may not need much treatment at all. You stay home for this. If there are questions, concerns, please reach out to your primary care provider on that. That's the best place to start. Life-threatening urgencies, difficulty breathing, inability to keep fluids, those type of things, that's where we want to see you. We want to be able to take care of you and treat you in a timely manner.
And so we've worked with the medical community, and they've really stepped up. So, we've had our hotline going for 20 months now at 541-464-6550. And that hotline has trained epidemiologists who are answering the phone calls. But in addition, the medical community has stepped up so that nurse case managers at each of the big clinics are going to be helping patients in those clinics. And Umpqua Health Alliance has stepped up to help people who don't have a doctor to provide care. And so if you call our hotline, we can get you to one of those areas and they can help you with questions. Because people will have questions, what's the dose of Tylenol? What's a normal oxygen level and such. And we've done other things to help prepare. So we know that with COVID, especially with Delta, that one of the big reasons people got hospitalized is because they had trouble breathing. Well, you can monitor your temperature with a thermometer, but it's pretty hard to monitor your oxygen levels unless you have something called an oximeter. So everybody has seen those. They fit on your fingertip here. And what they do is they measure your oxygen levels. So the county has purchased about 2,000 of these oximeters. And when you talk to your doctor, if you're at risk for having a respiratory complication, they can actually get one of these to you free of charge so that you'll have them at home to monitor your oxygen levels. That's the best way to do it. What we know with COVID is that some people are short of breath, oxygen levels are fine, there's nothing to do. Some people are seem similarly short of breath, and their oxygen levels are amazingly low. I mean, lower than we've ever seen before with other things. Oxygen levels in the 60s and 70s, and those people really do need help. So these oximeters we think are going to be great help. And then we're also working with one of the local medical suppliers to have oxygen concentrators available, so that if you're mildly ill, do need a little bit of oxygen, but don't otherwise need to be in the hospital, you don't need to be in the hospital, and you can take care of yourself at home. So, Dr. Gray, does the hospital have enough oxygen and respiratory therapists and ventilators and such?
That's one of the areas we've really been working to stock up on is supplies on it. We also have pulse oximeters that can be sent home with patients on it. Our oxygen supply, our medication supply, our protective equipment, all that is really good right now. We went ahead and preemptively ordered, borrowed a number of extra ventilators. We call BiPAP machines, those type of things in anticipation. Hopefully we don't need it, but making sure we have actually more than we did during the Delta surge on it. Staff is still the critical issue. Right now, our staffing is good. We're hoping for additional, we call traveler physicians, respiratory therapists, nurses on it, med techs, just to ensure we have the staff to take care of everyone right now.
And this phenomenon of using travelers and staffing companies is part of the solution, but it's also part of the problem. So these staffing companies recruit people out of school and pay them a lot of money, much more money than you would otherwise make, to go ahead and help out areas in need. But the problem, unfortunately, then is that they're not available then for a job in Roseburg or Reedsport. And so the hospitals in Roseburg and Reedsport have really had trouble recruiting new people. So if, let's say, you're just out of pharmacy school and you can make $5,000 a week as a traveling pharmacist, and Mercy is offering a very generous salary, but a lot less than that, it's pretty hard for the hospitals throughout the country to recruit. And that's been one of the big issues that we've seen. So the American healthcare system had enough people when people had the regular amount of illness, but now people have the usual amount of illness. We didn't cure diabetes or cancer, plus COVID, and it's really straining the system. And there are so many heroes at the hospital, aren't there?
Oh, there absolutely are. And I want to emphasize those travelers that we use. They have been an amazing group that have really augmented our staff. That we look to them, making sure we keep and we recruit the best of them. Those that don't fit have moved on that. So really have a great group. And like you said, the core group of nurses, of therapists, of technicians, of food services that have been here, our own permanent employees. We can't do that without them on that. We are always looking for staff. If you happen to have any leads, nurses, whether it be respiratory therapists, food service workers, EVS, please give me a call. Give us a call. We're happy to talk to them with some very good packages right now.
Well, staffing's trouble for everyone, but this is a hard time because the hospital need is really going to be a lot, we think, in the next month. But I think if there's any place around that is well prepared, I think it's been us, the medical people, the commissioners, the DME suppliers have been meeting several times a week to prepare for this for many weeks, and this is not coming as a surprise to any of us. We could see back as late as late November when the Omicron came out that this would be a problem, and we've been planning for exactly this for 6 weeks now. And I think we're prepared. So again, I use the weatherman analogy a lot. We cannot stop the snowstorm from coming, but we can have people get prepared by being sure that you have the supplies and the clothing you need to do it. Similarly for this, what we're asking people to do is get ready, have some supplies at house in case you need to quarantine or isolate for 5 days. Have the name and number for your doctor on board. If you don't, you can call our hotline at 541-464-6550, and they can get you that number. And the thing that we have to do is not panic. I mean, I don't think this is a reason to panic, but this is a reason to be prepared and to be concerned and to pay attention to what's going on. And that's why we'll do this COVID conversations at least once a week between now until COVID is gone. And we can only hope that that's soon. And the good news is, well, when we've started to see a fall off in cases in other areas, we can also hope for, I think, for a fall off in cases either at the end of January or the beginning of February. And there are some predictions that by March or April, the amount of disease in the community is going to be back to a very low level and allow us to get back to the many things we enjoy. So, Dr. Gray, any parting comments?
I'd just like to let you and others know we will be standing up outside of the emergency department a triage portable structure and triage tents on that. That is where we're going to be screening, evaluating people initially. Do they need to come into the hospital or not? Maintaining our bed capacity. So that will be going up today and over the weekend on that. Nothing has changed in our ability to take care of you, evaluate it. We're working with the emergency department, our community partners, to just try and smooth the process as much as we can on that. And again, back to what your points exactly. If you're ill, please stay home on it. We all have this work ethic to come in, do our job, but in essence, make it worse by spreading it to our coworkers, spreading it in the community, and actually harming us greater than the degree it helps us. So please heed Dr. Dannenhoffer's words.
Thank you. Well, I can only say, I hope my kids are listening. Okay. Well, thank you all. Again, this is Dr. Bob Dannenhoffer. It's January the 13th, 2022. We'll do this again next week. Thank you.